This is Frequently Asked Questions About Natural Migraine Relief for Women, Episode 14, Seasonal Affective Disorder and Migraine. Hi there, Jeff Baker here again as your physician host for Frequently Asked Questions About Natural Migraine Relief for Women. Do you find the winter months challenging? It's estimated that 20% of Americans are affected by seasonal depression each winter. Also called seasonal affective disorder or SAD, it includes symptoms like fatigue, oversleeping, carb cravings and overeating, difficulty concentrating and social withdrawal. Problems getting motivated, decreased sex drive, irritability and anxiety, losing interest in activities you normally enjoy, feeling sad, worthless or guilty, and even thoughts of suicide or death. It can also include physical problems like headaches. Migraine headaches and depression have what we call a bidirectional relationship, meaning depression increases the risk of migraine and vice versa. Those with migraine are about 5 times more likely to develop depression, while those with depression are over 3 times more likely to develop migraine headaches. Seasonal affective disorder and migraines are both neurological conditions, and while they are distinct, there can be some connections and interactions between them. These two problems may share some root cause factors that could be promoting either or both of them. Let's examine how seasonal changes in fall and winter could be a consideration in migraine or SAD, and then some strategies that could address either or both of them. One, weather changes common during the time of seasonal depression may also affect migraine frequency and intensity for some individuals, with barometric pressure changes and associated storms, wind, or weather extremes. Bright sunlight and glare off ice or snow can also precipitate migraines. These could explain the overlap between the two, but they don't offer easily fixable cofactors. Circadian rhythm changes with shorter and oftentimes overcast days means less sunlight hours and intensity in winter than the rest of the year. Most often, SAD symptoms occur in fall and winter when there's less sunlight. January and February tend to feel the worst in the northern hemisphere, that is. Experts think that the shorter days trigger a chemical change in your brain that causes your symptoms. In this regard, it would make perfect sense that the rates of SAD depend or vary on your location, with people living in northern latitudes being the most susceptible. For instance, in the U.S., SAD affects 10 times as many people in New Hampshire as compared to those living in Florida. Then there are changes to your sleep schedule when the nights start getting longer. You are designed to go to sleep when the sun sets and wake up when the sun rises. If you stray too far from this biological pattern, you will disrupt hormonal cycles, which can affect both your mood and your health. The link between depression and lack of sleep is well established. More than half of the people diagnosed with this depression also struggle with insomnia. In one study, 87% of depressed patients who resolved their insomnia had major improvements to their depression, with symptoms disappearing after 8 weeks. And while there are individual differences, as a general rule, one should aim for around 8 hours of sleep per night. Here's a twist. It turns out that dehydration can be as or more common in winter than in the summer. This sounds paradoxical given the generally cold weather of wintertime, but forced air heating in most homes is usually dry or low humidity air, and your respiratory water loss in humidifying that air can promote low grade dehydration. Disruptions to your normal routine when you're on vacation or engaging in holiday activities can be a factor. This can include letdown headaches or depression you may get when you are able finally to relax or decompress from those schedule alterations. Number six, allergies and viral respiratory infections with their symptoms like coughing, sinus pressure, and sneezing can promote or aggravate migraine headaches during the wintertime. Number seven, changes in serotonin and melatonin levels. Both SAD and migraines have been linked to serotonin, a neurotransmitter involved in mood regulation and pain perception. In SAD, lower levels of serotonin are oftentimes implicated in the development of depressive symptoms. In migraines, changes in serotonin levels can also play a role, and medications that affect serotonin are sometimes used to prevent migraines as well. It's possible that fluctuations in serotonin levels related to SAD may influence migraine symptoms in some individuals. Number eight, diet. Interestingly, vegetarians are 4 times more likely to suffer from SAD than non-vegetarians, so a primarily plant-based diet may not be ideal during the winter season. Vegetarians are also twice as likely to suffer from non-seasonal depression, which suggests that nutrient deficiencies may be involved in both. B12 and the methylated B vitamins are potential suspects in migraines and potentially SAD as well. Review their roles in migraines in the FAQ episode 3 and 13. Let's go to some therapy option considerations. I'd like to focus first on two of the most important treatment strategies for SAD and migraine, which are sun or light exposure and optimizing your vitamin D level, and then some thoughts on melatonin, diet, and hydration. Light therapy is considered to be the best available treatment for seasonal affective disorder, and I have seen it benefit many patients with SAD symptoms, including myself some winters. Full spectrum light therapy alone is more effective for seasonal depression than the antidepressant Prozac. Light therapy can improve mood and normalize sleep patterns in SAD patients, which may indirectly help reduce migraine frequency by the same mechanisms. Therapy includes sitting around 2 feet away from a light box with 10,000 lux to simulate sunlight for 1 hour in the morning, generally, giving the best benefit for seasonal affective disorder. You can generally find a quality entry-level light box online in the $50 to $70 range. However, if you have SAD and migraine and you find that full spectrum light therapy promotes or aggravates your headache, consider using green spectrum light as an alternative. Green light exposure has been found to release brain opioids and reduce inflammation. Its use has correlated with reduced migraine frequency, as well as improvement in those with fibromyalgia or neuropathy. Green light in the 515 to 535 nanometer wavelength spectrum at 4 to 100 lux light intensity has produced the best effects for green light. You'd use 1 hour per day in a room that is otherwise dark and without active light-bearing electronics. A simple example of this out in the marketplace would be the Norb migraine reducing green light with flicker-free narrow green spectrum at around $20 a bulb online. This can be used with any routine activity like reading, writing, listening to music or an audiobook or a podcast. Green light therapy used in the first hour of a migraine has been also found to lessen the impact of the event. Number 2, vitamin D3. I discuss the well-documented utility of optimal vitamin D3 levels for migraine frequently in the Natural Migraine Relief course, as well as in this FAQ blog and YouTube video. I would see episode 11 for more information. If you have either seasonal affective disorder or migraine, please get a vitamin D3 level done and aim for the optimal 60 to 80 nanogram per ml level, not just the get you by level of 30 as the minimal so-called normal level. Next, let's discuss some other measures that could apply to both seasonal affective disorder and migraine, starting with melatonin levels. Melatonin is another important player that is influenced by your circadian clock and exposure to bright full spectrum light. Your master biological clock resides in the suprachiasmatic nucleus of your brain. Based on signals of light and darkness, this SCN tells your pineal gland when it's time to secrete melatonin and when to turn it off. One of melatonin's primary roles is regulating your body's circadian rhythm. When it gets dark, your brain starts secreting melatonin, which makes you sleepy. Levels generally stay elevated for 8 to 12 hours, and then as the sun rises, your pineal gland reduces your production and the levels in your blood decrease until they're hardly measurable. In people with seasonal affective disorder, decreased wintertime light can disrupt melatonin production. However, some may overproduce melatonin, leading to feelings of sleepiness and lethargy. If you do take melatonin to help with your migraines, but also have SAD, you may need to decrease your wintertime dose. As regards diet and hydration, if you're indoors with forced air heating during the winter, you almost certainly need to ramp up your hydration during these months. You should also make sure that your diet or supplements supply sufficient B12 and what are known as methylated B vitamins, including methylfolate, methyl B12, and methylated B6, also known as pyridoxal 5-phosphate. Deficiencies in either of these are potential suspects in migraine and potentially seasonal affective disorder as well. Also consider augmenting your omega-3 fatty acid intake. Omega-3s are fundamental brain building blocks for daily brain function and optimal mental health. Studies have shown that those with lower blood levels of omega-3s had more symptoms of depression and a more negative outlook on life, while those with higher omega blood levels reported the opposite. And when it comes to migraines, omega-3 metabolites help protect against and help to resolve inflammation. Without sufficient omega-3s, the inflammatory response as a root cause of migraine headaches may persist longer and become chronic. Additionally, optimal omega-3 levels help your mitochondria to produce energy more efficiently. Reduced mitochondrial efficiency can also be a root cause contributor to migraine headaches. Usually 1 gram of omega-3s per day with the DHA/EPA component ratio of 2 to 1, such as DHA 650 milligrams and EPA 350 milligrams, is a reasonable dietary target. A test called the omega-3 index can tell you where you are on the omega-3 content in cell membranes. Levels of 8 to 12% are optimal, while levels trending low toward 4% are associated with a multitude of health issues such as autoimmune and cardiac disease, as well as brain aging disorders. And for instance, when it comes to heart disease, having an omega-3 ratio of 4% increases the risk of sudden cardiac death by 90% compared to those having a ratio of 8%. It's important to note that not everybody with seasonal affective disorder will experience migraines, and not everybody with migraines will get SAD. Those conditions have complex and multifactorial causes, and their relationship can vary from person to person. If you have concerns about either SAD or migraines, it's advisable to consult with your healthcare professional to collaborate on a personalized assessment and treatment plan. If you are interested in knowing more about the root causes of migraine headaches and how to address them directly with non-drug therapy, you can review the contents and purpose of my online course, Natural Migraine Relief for Women, by going to naturalmigrainerelief.online.